Sure. Well, he's starting. Commissioner Barnhart.
Good afternoon and welcome to this edition of Berks County Commissioners Weekly Update for Wednesday, September 9th. And we have a really good program today. It's on the update on county contact tracing program. Today's media event is live on Microsoft Teams and live streaming on Facebook. It is not live on BCTV because they are switching out equipment, and not live on YouTube, but will be posted on YouTube in a few days. Comments and questions must be germane to the topic being discussed and include your full name and municipality where you reside. If you are from the media, please place your name and what affiliation you have with the media. Non-media participants, please limit your questions and comments to one per person. So with that being said, this program is going to be about cooperation in our community. I know we're all suffering from COVID-19 fatigue, but it's really important for us to continue to send a message out there to the community far and wide about things such as contact tracing. We have with us today a real great panel, but first, before I open it up to our panel for questions, I'd like to turn the program over to Commissioner Michael Rivera for a few comments. Commissioner Rivera.
Yes, Commissioner Barnhart, thank you very much for putting this program together. And I also want to thank the panelists that are here today. As Commissioner Barnhart had indicated, this is a very important topic, and I know we're going to have some good discussion around it, clarifying some questions as well. So again, I want to thank the panelists for being here today and sharing the information that you're going to share. I just want to remind everyone that tomorrow, September the 10th, is when the Small Business New Start Grant Program opens at 9 a.m. And you can get more information on that at Rebuild Berks. And I'm just getting information here that the application portal is housed on the Community First Fund website. And that is communityfirstfund.org. And it's a whole big address there, which I will not go over. But if you go to communityfirstfund.org, you'll be able to navigate there and get to the application. It will be live tomorrow starting at 9 a.m. and it will be open for 10 business days. So it will be open through September the 22nd. Keep in mind, this is not a first come, first served program, so you do not need to rush in tomorrow at 9 a.m. to get the application in. But please go in, see the information that you will need to provide so you can start getting that ready. And the sooner you can get it done, the better. The application, the grant amounts range from $10,000 to $50,000. And there have been $6 million from the CARES Act dollars allocated to this grant program because we understand the importance that small businesses play in our county and in our different local municipalities. So for more information, you can go to the Community First Fund website. You can also visit rebuildberks.com for more information. Again, that is rebuildberks.com for more information. So if you are listening to this and you are not a business owner, but you do know of a small business owner, please ask them to go to communityfirstfund.org or to rebuildberks.com to get more information on this great program that will be available starting tomorrow, September 10th at 9 a.m. Commissioner Barnhart, back to you.
Commissioner Rivera, thank you for that important and timely information. I believe it's also going to be on the county website tomorrow as well.
Yes, you'll be able to get the information there as well as in doyourpartberks.com.
Right. As many avenues as possible, get this money out to the community that sorely needs that support. Mm-hmm. Commissioner Leinbach, calling in from Parts Beyond. You have a few comments?
Yes, thank you very much, Commissioner Barnhart, Commissioner Rivera. This is a very important topic, and I want to compliment Commissioner Barnhart has been the point person for the county on the contact tracing, and he has gone out of his way, as has Carolyn Basic and her team, in being completely transparent. This is a voluntary program. It's a transparent program, and as somebody posted on my social media this morning in a positive way, when I announced this program, they said, notice it's contact tracing, not contact tracking. It's voluntary. And I'm looking forward to this program, even though I'm listening in. I'm not able to see it. That's why I'm calling in. But I'm really proud of the work that Commissioner Barnhart has led and the work that Cook County Wellness has been doing in the contact tracing. Some counties have relied 100% on the Pennsylvania Department of Health in light of the challenges that Pennsylvania DOH has faced and continues to face. I am very glad that we made the decision to bring Cook County Wellness on board and lead this effort at the local level. So Carolyn, your team, I cannot thank you enough. You've been great, and the transparency of the weekly reports have been fantastic. Thank you.
Thank you, Commissioner Leinbach, and thank you to my colleagues for being part of this really, I think, an awesome team putting Berks County first. So just going back a little bit, we contracted with Cook County Wellness Services back on June 8th. Prior to receiving any sort of indication as to CARES Act money, this board truly believes that contact tracing, and still believes it's one of the key components and very important on keeping the spread of the virus to a minimum. And there were some news accounts that we signed a contract for up to $1 million. That was kind of a estimate. We noticed from other counties where they were spending tens of millions of dollars on contact tracing. No one knew, but I want to tell you, this is a very cost-effective program. Cook County Wellness Services are to be commended for being in the community since the mid 80s and were basically a partner from the beginning. They already were a contractor with the county. So it was an easy lift for us to go to Carolyn and her staff to start this. I don't know where we'd be if we had to bring this up from the ground up and didn't have a Cook County Wellness Services in Berks County. To Commissioner Leinbach's point, we did not want to rely on the state. No disrespect to them, but they've got an awful lot of territory to cover. And until they ramped up, we're probably 2.5 months ahead of that curve. So just wanted to frame that a little bit. I'd like to get the introduction of our panel. It's Carolyn M. Basic, MBA, Executive Director of Cook County Wellness Services. Her Deputy Director, Barbara Waller of Cook County Wellness Services. And of course, Brian Gottschall, Director, County of Berks, Department of Emergency Services. Welcome, everyone.
Hi, welcome. Thank you for having us.
Thank you. So in no particular order, we will field some of the first questions. We'd like to have a general overview of the contact tracing program, kind of the background and its main purpose.
Sure, I'll take that one, Commissioner Barnhart. So basically, contact tracing has been around by various names for lots of years. It used to be called partner notification in the days of the HIV epidemic. And basically, it's a tried and true public health tool that we use in that we want to reach out to people who have potentially been exposed to COVID-19. And so at the end of the day, what happens is that the purpose is to try to stem the spread of disease in our community. We all want to get back to some semblance of normal. We all want the economy to rev up again, and we all want to get back to our lives. And absent vaccine, absent other therapeutic methods, the way we do that is to use public health practices, and it's to test and to contact trace, identify those who are ill, isolate the ill, quarantine people who have potentially been exposed to them. And you do that through contact tracing, which basically involves reaching out to people who could have been exposed to someone who was positive for COVID-19. And my colleague, Barbara Waller, will talk a little bit more about how the process works and how the connection exists to the Department of Health.
Just switching spaces for a moment.
Thank you. Good afternoon.
Good afternoon. The process is fairly simple. Obviously, there's a laboratory involved somewhere where a person is tested. There's a positive result. That laboratory feeds the information into a database called NEDS. It's one that has a lot of things, but all the mandated diseases are fed into that, like syphilis and HIV and positivities and all that. COVID-19 is just another entry into NEDS. And that is throughout the state. then our Department of Health nurses, which we are the Southeast region, they go in and all for our region are pulled out, and then they call that down all for Berks County, and they call the people who are positive, and they talk to them, and they create an investigation number. So they get information from the positive of their contacts, and as much information as possible. When they're household exposures, they can do date of births and, of course, addresses and phone numbers and emails if necessary. That information is fed into another database. At this point in time, it is called SharePoint, and that is where the contact tracers that we work with see the information. They never see the name of the person who's positive. It's simply a number. And then they call the contacts that are put in the base, and they talk to them about quarantining and also isolation, because many of these are household exposures where people are living together in the same household. We help explain the differences, the basic 10-day isolation as long as you are not symptomatic for 24 hours by the end of that. And then the 14-day quarantine, which starts after the case is finished isolation, and how to do it, what you can do in limited circumstances. If you're living in a smaller apartment, just wearing masks, cleaning, washing your hands, trying to stay as separated as possible from the case, and going on from there. We then notate and annotate in that database, and we suggest to everyone that there is an automated database that the state has started with that was generated and made in March and April just for COVID-19, and it is called Sarah Alert, and it offers either robocall, text, or emails to the individuals who are quarantining. And those individuals they normally have a head of household, so you don't have 5 phone calls or texts coming into a household. Comes in for each head of household, and those people will answer questions on symptoms for all the members of their household that are listed. And that database, so we can follow if people are turning symptomatic, and it will automatically notate that in the database. And then those people can get their calls. And if they want, and if they hesitate because they're not comfortable with that, we can do what we call paper monitoring, which my contact tracers call them every day for 14 days and see how they're doing. And we offer help if they have problems negotiating, having food delivered, pharmacy delivered, things like that. We reach out to see if we can help some of the families that need that. So that's the basic way that we handle that.
So a general question for the panelists: sounds like an awful lot of complicated things ahead of time from the actual test to the positivity. Is there a time that is anticipated someone tested until the contact tracing starts? Is there an average amount of time, and has there been a lag recently, or has that number been improved?
Ideally, there is a amount of time, but yes, there is a lag time. Remember, the lab has to put it into NEDS. Let's assume that you get the results come back and the laboratory doesn't immediately flow into NEDS, but you've been called and you've been told you're positive, but that information hasn't gotten in for the nurses to look at. And so there are a lot of timing roadblocks that you could see along this way. And a lot of different databases. The state is going to make a change. SharePoint will ultimately be gone, and I believe that the new database is called Salesforce, and that's going to do some more automated from NEDS directly to Sarah Alert with our contact tracers getting the information in between. So that will speed up the process of the phone call coming to the individual.
Yeah, but you're right, Commissioner. For now, we have struggled with, we can't do our job until the Department of Health nurse does the case investigation, and the Department of Health nurse can't do the case investigation until the lab reports the positive result to NEDS. And so you can see that if you go get tested today and it takes the lab 5 days to get your test result back, and then takes another 2 days for that to get into NEDS and the nurses to do the contact investigation, you're now 7 days away from when you first were tested. And so by the time they call you, you could be, depending on your symptoms, you could be a few days away from getting out of your isolation period, and the quarantine period would just be beginning then for the people you're living with. So ideally, you would like this to all happen within 24 hours. From the time it gets into NEDS, for the nurses to do the case investigation, they try to do that within 24 hours. But obviously it doesn't happen, and when there's larger exposures, because people do silly things like have huge barbecues or big house parties, and there's lots of potential exposures, it takes time for that to process. But one of the keys that Barbara talked about was the fact that we monitor people who are in quarantine, and we do that for a reason, because oftentimes those people will become cases. They will convert to positivity sometime during that quarantine period. And if we can catch that and get them to go get tested, obviously, because they've been in quarantine, hopefully they have fewer contacts that they've been around as well.
So, Callan, you touch on something very important. It's again about cooperation. No more than 25 people indoors at any one time. No more than 250 people in an outdoor gathering. People have to be reminded, and you just think people know, but they still take that risk. And really, it's about stopping the spread of this virus, and all of these efforts come together in trying to mitigate that. Brian, from your experience in dealing with the emergency management directors across the Commonwealth, where does Berks County stack up with respect to this contact tracing and what we're finding here in Berks County overall? You're muted. It's okay.
Thank you very much. I think the counties are taking different approaches to this problem, as you noted. We certainly have firsthand knowledge of some of our partner counties who have made significant investments in very expensive contracts with large healthcare systems. In Berks County, we chose to go with a known community partner who is able to operate extremely efficiently and very agilely and do this at a much lower cost. In some counties, the counties have done nothing at all and are relying on Department of Health to bring to the table solutions to do this thing whole hog. My argument, my personal belief is that we have taken a great middle line here in Berks County in using a known and trusted community resource who's able to do this work for us in a very efficient and local fashion, but have done so in a way that acknowledges the responsibility the county government has for public safety, not done what some other counties have done and said, well, you know, we're really not a public health entity, therefore this isn't our responsibility. I believe that we've walked that middle line and we've done it the right way, I'd like to think, in Berks County.
I think I could speak for my colleagues that we get the weekly updates from Cook County Wellness, and I think our rate of people responding and being part of the contact tracing program is phenomenal. I mean, there's still skeptics. There's still people that hang up. There's still people that give you bad information because they don't want to be bothered. But that seems to be a very, very small minority as opposed to people get it and understand how significant this is to stop the spread.
Yeah, absolutely. I would say that our rate is, you know, our refusal rate is somewhere between 10 and 13%. And some of that rate is even lower because because of the lags in the testing that we talked about earlier, people refuse sometimes not because they're being ignorant, but because they're a day from the end of their quarantine period. And what's the point by the time we're able to reach out to them? Because it takes that long for the process to kind of work.
Yeah, and we are seeing, not with my contact tracers, we don't have as many where they refuse us. The refusals come right at the time the nurses are talking to the cases, so that it comes out to us as a refuse. And usually it doesn't have a name, doesn't have an address, doesn't have a phone number, you couldn't do anything with it if you tried. And that's what is happening. But our tracers seem to be able to have the time, explain what things are, explain databases, that when the nurses got this long list, they can't, I don't know how much time, but I'm sure they don't take the amount of time that our people can do. And call them back. If you have a question, don't hesitate. And we have people that are interacting with our tracers on a regular basis.
Yeah, so even if they refuse at the Department of Health level, if the Department of Health at least puts in a phone number for us, we'll assign that to one of our tracers, and several of our tracers are very, very good at convincing people to cooperate who might have otherwise been uncooperative, because they explain the benefits that aren't always laid out.
That's wonderful. Brian, you were commenting?
Yeah, Commissioner, I think it's worthwhile to kind of dig into that matter of why are Carolyn and her folks so successful while we're still seeing refusals at the higher level, you know, in that initial contact with the state. And my assertion would be that people remain confused about this process. And I would argue it is somewhat confusing. You hear all kinds of news stories, you read things, you hear about these electronic applications, and I still talk to people, even close family friends, who are concerned about privacy and, you know, they're going to track me through my phone. And I think it might help to kind of separate some of those things and talk about where some of the electronic processes exist and how those are different than what Cook County Wellness and DOH are doing. You know, we live in this world where Alexa and Google Home are listening to us all the time, and we have a conversation in the privacy of our house with our loved one, and then we go to Facebook and we see some advertisement about the thing we talked about, and it certainly makes us question privacy and what our electronic devices expose us to. I just think it's important for folks to understand that these things that we're hearing about, particularly at a national level with the major technology companies, where they're putting in place these capabilities that we can download and leverage to take advantage of, are not the same as what is going on here at the local level and what Carolyn and her team are doing. That no one is installing a tracking device on your phone. Does that technology exist? Are there apps that you can download now to make that available to you? Absolutely, but that's of your discretion. That's your discretion, your choice. You can choose to do that if you want to. It's not a core part of what Carolyn's team is working on or even what DOH is doing. That has now been made even a little bit more complicated by the fact that DOH is in fact working on an electronic application. Again, a voluntary application that people can download if they choose to, but it is separate and not part of what Carolyn and her team are doing. What they're doing is really not intrusive. It doesn't violate your privacy. It doesn't let other people know what's going on in your life. And I just think it's really critical that folks understand that there is a clear separation between those two things.
Carolyn, comments from that point as far as the technology?
Yeah, absolutely. And Brian is 100% absolutely correct. So to date here in Berks County, there are no apps, there are no tracking devices, there is no intrusion. We get the data, and as Barb pointed out in her little conversation, we don't even know the name of the person who's positive. We get an investigation number of which the contacts are associated with. Now, if our tracer's on the phone with that investigation, you know, the contact may say, oh, well, you know, I know it's my husband who's positive, or it's my son who's positive, and they live with me. If the contact discloses that, that's up to the contact, but we have no way of knowing. The only piece of information we get is whether it's a household contact or not. Barb talked about Sarah Alert. That is a piece of technology that our tracers offer voluntarily to the contacts. It's an ability to put their information in and for them to get a text, a robocall, or an email that asks them to check on their symptoms throughout the 14-day quarantine period. The cool thing about Sarah Alert is that when the quarantine period ends, within several days, it goes through and it flushes anybody who's out of quarantine. So it does not keep data. There is no record of the fact that you were ever in Sarah Alert. When your quarantine period is gone, your information is gone as well. That's why I have to go back and do the math for those transparent reports I send you every month, because the people that were in Sarah Alert disappear at a certain point. And so I've got to know who was there in terms of numbers in the previous week and how many people have been closed out. Now, Brian does bring up a point about this technology that Pennsylvania has been working on in cooperation with some other states nearby, like New York and New Jersey and Delaware, and they have been working with the developer and will be, and they've put out several press releases, they will be rolling out something called COVID Alert Pennsylvania, which is a voluntary, and there's the word again, voluntary app, just like any other app you put on your smartphone. And it scares me because Brian's right. Sometimes I think our smartphones are smarter than us and track and know our tastes and our likes and dislikes just based upon where we go and what they're able to track. But every time you put an app on your phone, you have to approve that app being on your phone. And you are given a set of information to review or to read that you have to consent to in terms of what that app is or isn't going to do. So when this app comes out, it will be available on the App Store. It will be available on Google Play, but it is voluntary. If you don't put it on your phone, it can't track you and you can't participate with it.
That's brutal.
And what the cool thing about this app is much different than some of the ones that Brian referred to, where they're tracking people's movements by GPS. This particular app is nothing like this. This app is 100% anonymous. And Dr. Levine talked about it at a press conference, our Secretary of Health, and she says, we want you to know the entire system is anonymous and it is completely voluntary. It doesn't track your travels, but uses the same tech our phones use to communicate with one another. So it uses Bluetooth technology. And if you'll just indulge me for a minute, let's say that Brian and I both decide, for whatever reason, we're going to put this app on our phones when it comes out. And so now we're out. I'm out at the Giant and I run into somebody and I don't know that person real well, but I have a conversation with them, kind of lengthy. We're in an aisle talking about something that we're buying at the store and we're going back and forth. If we both, our phones are exchanging anonymous identifiers, which Bluetooth calls beacons. Okay, now a few days after that conversation at the store, I test positive for COVID-19. And when the State Department of Health calls me, they ask me if I have the app installed on my phone. And I say yes. They give me an identifying code that I put into my phone on my app. Now, they're going to ask me with my consent, after I put that code in, they're going to say, can we upload the last 14 days of these Bluetooth keys to the cloud? And if I say yes, those identifying keys, which have nothing to do with me, they don't know my name, they just, you know, I'm attached to a code, they'll upload them to the cloud. In the meantime, the person I was talking to, let's say it was Barbara, but I didn't know Barbara, okay? She has the app on her phone and she's going about her daily business. And every so often, the phone downloads the broadcast keys of everybody who's tested for COVID-19 in her region. And now a match is found with my key because she was near me. She will see a notification, Barb would see a notification on her phone, and it would tell her that she was exposed to someone who's tested positive and give her information on how to, and about what to do in next steps.
And
So,
Karen, just to build on that, I believe I'm correct in my understanding that it also is looking at the timing of the proximity of those beacons. So going back to your example, if I just walked past you in the aisle at Giant and wasn't in close proximity to you for the required period of time, it wouldn't trigger my phone to get a notification.
you are absolutely correct. You are absolutely correct. We must be near each other for 15 minutes or longer for that beacon to send a message that says that releases positivity information to someone you were around. So if we were standing in line 6 feet away from each other, it wouldn't. And the other important key about Bluetooth that people don't always understand is that it can't track you when you're more than a few feet apart. So if somebody's a half mile down the road and has the app on their phone and I'm a half mile down the road the other way, it can't exchange beacons because we're not close enough for Bluetooth technology to work. It only works when you're within feet of people, not when you're within larger distances. And again, this is 100% voluntary. If Brian doesn't put it on his phone, I don't put it on my phone, and Barbara doesn't put it on her phone, guess what? Nothing's going to be exchanged because we don't have the app. And this is not meant to replace contact tracing. This is meant as an enhancement to contact tracing to help us pick up. I might not know that person. And here it is, and the Department of Health calls me and they're asking me for my close contacts. And I'm like, geez, I was shopping at the Giant and I was talking to this lady, but I don't know who she is, right? So how would we get that? How would I be able to share that contact information? Because sometimes you're around people and maybe you're close to them, but you don't remember their name, you don't know their phone number, you don't have personal information that you can share with the investigator that calls you from the Department of Health. So once again, this is a tool. We talk about tools in our tool chest. We don't have a vaccine, we don't have a lot of good therapeutics yet. It's a novel coronavirus, meaning that it's new. just like HIV was new back in the 80s, just like herpes was new at one time, just like other transmitted diseases were new, you know, Ebola, dengue fever, they're all in that same family. And it takes years sometimes to learn how a virus reacts. And so we're still learning. New symptoms are being discovered as to how it tracks back and traces back to COVID-19. And so until we learn more about the virus, what do we have at our disposal? We have social distancing, we have washing our hands frequently, we have wearing a mask, and we have contact tracing to help us stem the spread of the disease in our communities, coupled with testing.
So, Carolyn, just to tie all of that up in a bow, because you used adjectives a couple times throughout that, redacted, transparent, but for the benefit of the viewers, I want to make 100% clear that the report that you guys are providing to the county commissioners on a recurring basis also is completely anonymous. It's reporting on your actions, it's reporting on the percentage of people that participated, but there are no names, and county government has no knowledge of who any of these people are.
That's absolutely correct. All we can tell you is that we talked to, you know, from this week to last week, this many new contacts have been in the database. We've been able to trace. So many people have refused since the outset. You know, so many people are in Sero Alert. So many people are being paper monitored, but there's absolutely no identifying information. I don't even have that identifying information. And oftentimes, you know, our tracers don't even have a name. They just get no name number one and a phone number. And they call and say, hey, we're calling from Coe County Wellness Services on behalf of the Department of Health. You've potentially been exposed to someone who has COVID-19. Most of the time, people will cooperate. Sometimes people hang up. I'm not sure what people think they're protecting by hanging up and by not, or by giving us a bogus phone number, because really the only thing they're doing is helping the disease potentially spread. They're not protecting themselves or their families, because this information isn't going anyplace. It's gone. Sero Alert wipes it out. We don't keep it. And when cases are closed, eventually they start to go through the SharePoint database as well, and we'll start to make closings. And as Barb pointed out, they're going to be closing down SharePoint in several weeks and moving to a new contact management system, I believe, called Salesforce, I think it's called.
Salesforce, yes.
Salesforce.
It's so important for this part of the discussion to understand the tools are there, they're voluntary, everything's voluntary, and how critically important this stuff is not shared with anyone. It is highly confidential, and I think that's really the message people have to understand. Everything is voluntary, and it's also confidential, and your firm doesn't even know who the people are. I think that's really a myth out there that needs to be shattered. So I think to make it a little easier for the viewers and the public, what's a process a person should expect when contacted by a contact tracer? I get a phone call from a contact tracer. What should I expect?
You should expect someone to be, first of all, we try to gain your trust. So we are not pushy, we are quiet, we ask the questions, and we try to explain the differences about isolation and quarantine. And we have to keep going over this because a lot of people don't understand. And it's harder to quarantine than it is to isolate because a lot of people are asymptomatic. They whiz through isolation. There's nothing with it. And now they go off. They can go back to work with whatever their work fed. They may ask for testing, but whatever they do. But that all the rest of the family, now they start 14 days of quarantine and trying to explain and the importance of this, how important it is that when you quarantine, that really means you quarantine. You're not down the hall, you're not in the social rooms, you're not around, you are actually trying to quarantine and be away from other people, just your family unit. So they expect, so they'll ask that, they will ask you about other people in the, because we'll get a drop down list of the names that were given by the case, but so we might not have all of the correct spellings of the names. We go over that, get dates of birth if we possibly can, because if we have a date of birth, we will question who answers the phone. And if we're supposed to be talking with John Smith, we will, and have his date of birth, we will ask John Smith to please let us know if a correct date of birth so that we know we're talking to John and John knows that he's talking to a contact tracer, not a scammer, okay?
Well, Barbara, how does this differ if the contact is a minor, how, like, will you talk to the person's parents or legal guardian?
Yes, you will talk to. Sometimes you do have children that answer the phone, so that we try to get to the adult in the household. No information is taken from a child, but because of the fact that you cannot have a head of household that is a case, there are sometimes in Sarah Alert that the head of household is younger because they are the only person left in the house that doesn't have COVID. So they're listed, but the parent is still the one that does the text or answers the phone or gives the information, but it's just the system with that. And we talk to the parents because sometimes we don't have all the children listed. There might be 4 children in the household. So we remedy that in our notes to let people know. And we're trying to say, explain, get their trust, and say, now what can we do to help you quarantine? What do you need from us? Do you have friends who can drop food off for you? Do you have people who will run to the pharmacy? There's somebody that'll go, what are you doing? I mean, do you have stuff to entertain the kids? Do we need to see that some activities are brought over to the house and things? I mean, all the kind of things that you try to get people to be comfortable so that they can go forward with that. And I want to explain, and we haven't even mentioned it, everything we do, we have bilingual tracers, and Sarah Alert is a bilingual in Spanish database, and they're adding other languages. So we are trying to be as comfortable as possible so that people can talk to someone that they want to talk to. And we ask those questions because some people totally are fine in English, but their comfort level is talking in Spanish. And we make sure that we have someone that does that. That's why we have teams that call. And if someone calls and they need a Spanish speaker, that person on that team, there's a Spanish speaker on each team, and they'll continue, and the 2 of them will continue with the tracing. So that's what we do. We put the information in, and as I said, we will call them on a daily basis if they want us to call back. And we certainly, if they seem hesitant or are starting to be slightly symptomatic, we're going to call back to see if they're getting worse. And if they're getting worse, we're going to be directing you to your doctor, your clinic, or an ER, depending on the level of where you are in your symptoms, etc. And that's, our contact tracers are aware of what they should be doing, and that's what we try.
So us out on this, there's going to be the mobile testing unit in Berks County, I guess the 11th and 13th, if not mistaken, ladies.
Yes.
Right, it's the 11th and the 12th. The 11th is going to be at the Y in Reading branch, which is on Washington Street. And the 12th is going to be at the Sinking Spring YMCA at 4920 Penn Avenue. And they're going to be there from 11 a.m. to 3 p.m. And this is a free COVID testing. And they are mobile vans. So and
who can go there and be tested? What's the criteria?
Provides free COVID-19 testing to people who are showing symptoms or who have been exposed.
So I don't need a script from my doctor, but if I feel symptomatic or I feel I've been exposed, then I qualify to go to mobile.
Absolutely. And if someone would have contact traced you and you haven't had time to get a test, this would be an ideal, if you are exposed, this would be an ideal way to get testing.
Wonderful. Brian, you had your...
Nope, you went exactly where I was going to go, Commissioner, just clarifying that this isn't just walk in because you're bored